Good morning. I'm John Goodman, and I'm self-isolating in my living room right now. I suspect you're doing the same. Even so, I'm going to be very respectful of your time and give you a short update on three problems. Why the Republicans don't have a health plan, some remarkable things that the Trump administration has done in health care that maybe even Donald Trump doesn't know about, and how all this relates to the coronacare virus. Republicans once did have a health plan. Back in 2008, John McCain had a really good plan. And he said we should take all of the spending and all of the taxes that come from the federal government, divide it up and give every American a lump sum tax credit and let the health insurance market work. And I helped him with that plan. The problem was he didn't understand it. Most other candidates that ran on the same ticket with him didn't understand it. Certainly the voters didn't understand it. And the media was not in a mood to help anybody understand it. Well, we go almost a decade later, and I sat down with Pete Sessions and Bill Cassidy, and we updated the McCain plan, made it a lot better, thought of ways to market it in ways that voters could understand. But there was no willingness on the part of the Republican Party to take up our cause. Now, last month was the 10th anniversary of Obamacare. And you may have noticed in all the newspapers, the magazines, and the news sources, everything that was said about Obamacare was good. They talked about how more people were insured and other things. Nothing bad was said, but a lot of bad things have happened. Premiums have doubled. The typical out-of-pocket deductible is 3 times what it is in a normal employer plan. There's been a race to the bottom on access to care. Here in Dallas-Fort Worth, you can't buy an individual health insurance plan that will get you into UT Southwestern, which is probably the best medical research facility in the whole world. In the entire state of Texas, you can't buy individual insurance that gets you into MD Anderson Cancer Center down in Houston. And this is happening all over the country. And yet, despite all these bad things, Republicans went 10 years without ever having a single hearing on victims of Obamacare. If it were the other way around, if Obamacare were a Republican idea, Democrats would have had a hearing every week showcasing people who were made worse off. Republicans never did. Let me tell you briefly what it's like to be a Republican on Capitol Hill. We have a $3.5 trillion healthcare industry. Huge amounts of money are at stake. And just about every day, somebody is calling on your office to tell you what they want. The drug companies, the insurance companies, the employers, the doctors, the hospitals, it goes on and on and on. And not one of them ever says to the Republican office holder, wouldn't it be great if patients could talk to their doctors by phone? And they don't say this because, I'm sorry to say, they really don't care about patients. And none of them ever says, wouldn't it be great if employees had health insurance they could take with them from job to job and in and out of the labor market? Because again, they really don't care about employees. Now, the candidate, the congressman sitting in his office, therefore, never hears about the reforms I'm going to talk about in a moment that the Trump administration has initiated. And when he goes home to talk to voters, he doesn't hear from voters because they haven't thought about the fact that, well, maybe they should be able to talk to their doctor the way they talk to their lawyer or their accountant or any other professional. And they don't hear about it from the media, of course. And strangely, they don't hear about it from other think tanks because those think tanks have donors that are not focused on these kinds of issues. And so we have a Republican Party that doesn't know what to do about health care. You might think ordinarily Republicans would like free market health care, but they don't know what that would be like. We haven't had a free market in health care forever. Now, 55 years ago, Earl Botkin could go in his garage and invent the pacemaker. He could try it out on a few patients, and when he discovered it really worked, he starts Medtronic, and by the time he retires, he's a billionaire. No one today can do what Earl Botkin did. You can't make anything in a garage or anywhere else, not masks, not gloves, not gowns, not anything relating to health care without permission from the government. So we have a totally regulated health care system. Well, Donald Trump gets elected, and on the day he's elected to office, he is faced with a law that says that Medicare doctors cannot talk to their patients by phone, email, Skype, or Zoom. that is not prohibited by act of Congress, except in some unusual circumstances. The day he is elected, it is against the law for employers to put money in accounts for employees so they can have their own health insurance, which they own and can take with them from job to job. It's against the law for the employer to put money into a health savings account so the employee can have 24/7 access to a doctor. Today that's called direct primary care. We used to call it concierge care. That was not allowed. And it was not allowed for anyone to buy insurance for any length of time that was not totally regulated by Obamacare regulations. That's what life was like when Donald Trump was elected. Now, the Trump team put out a very unusual document. It was a long document. It went many, many pages. And the theme of the entire document was that in healthcare, government is not the solution, government is the problem. You know, if we want to solve healthcare problems, we need to get rid of laws that prevent people from talking to their doctor on the phone or at night and on weekends. We need to get rid of laws which make it impossible for the employee to have his own insurance, which he takes from job to job. We need to get rid of legal restrictions which make it impossible for people to buy insurance which meets their individual and family needs. So out comes this long document. And then the administration began doing things by executive order. I got to tell you that when Obama was president, a lot of Republicans complained that he was using his executive authority to do things Congress would not do, and that ordinarily people thought Congress needed to do. Well, Trump has been just as aggressive, if not more so. He's been pushing the envelope with executive authority. He's been sued by the hospitals, he's been sued by the drug companies, he may yet be sued by the doctors, and he doesn't seem to care. So he has liberated a group of people who see it as their mission to liberate the healthcare marketplace, and this is before we had the coronavirus crisis. So probably the most important executive order was a reversal of Obamacare, of an Obama administration order, which said that employers may not give their employees money to buy insurance which they own. And Trump reversed that, and as of January 1st of this year, every employer in the country could do that in principle. Now, most probably didn't know about it because this kind of reform, along with other Trump reforms, has not been reported not only in the healthcare media, in the general media, it has also not been reported in the healthcare media. So most people don't know about it. But with millions of people losing their jobs, that would have been the best kind of insurance to have, especially if you're not entitled to a subsidy in the Obamacare marketplace. So the Trump administration began pushing the limits of their executive authority, allowing employers to give employees insurance which they could take with them, personal and portable. They allowed employers now to use the health savings account so the employee can have 24/7 access to a doctor. Coronavirus doesn't just hit during the working hours. It's there on weekends, it's there at nights. And so that kind of relationship with a doctor is really an ideal way to provide primary care. And then the Trump administration has made what's called short-term insurance available. Under Obamacare, you could only have this for 2 months. Under the Trump administration, you can have it for a year, and you can renew for 2 more years, and then you can have another policy which allows you to go another 3 more years without any change in premium because of a change in health status. I said earlier that I'm not sure that Donald Trump is even aware that some of this has taken place, because when I watch him on TV at his briefings, I don't think he is fully understanding that his administration laid the groundwork for a lot of the changes that are right now taking place. Here's something you need to know about the changes in relationship to the coronavirus. They're temporary. Everything Congress has done, Congress has now said, okay, it's okay for the doctor to use phone, email, Skype, Zoom. You can do that now. The patient can be in his own home. You can consult, you can treat, you can test, you can monitor, you can do all these things, but only for the duration of the coronacare virus. If this virus goes away, this relationship between doctors and patients goes away as well. That would be too bad. We need to make these changes permanent. Everything Donald Trump has done by executive order could be undone by another president reversing those orders, just as Trump reversed the Obamacare executive orders. So what we need to do, tying this all together, is we need to make people on Capitol Hill aware of these changes in health policy. They need to become aware that the reason we're doing as well as we are right now is because we are deregulating. We're getting government out of the way so the private sector can meet needs in the most efficient way. And we need for the Trump administration to understand that, that there's a relationship between what it's now doing and what people who've been working for Donald Trump have been doing for 3 years. We're going to have more to say about these things in future briefings like this, but as I said at the beginning, I want to be respectful of your time. There's much more that can be said. Thanks so much for spending time with me this morning. I think you know we're a nonprofit organization. We depend on voluntary contributions from people like yourself, and that's the only way we can sustain the work we're doing. If you like what we're doing, you want us to continue doing it, then we do need your help. And on the page below this video, there's an opportunity for you to give to us. And if you have a few extra shekels in your pocket, now's the time we could use the help.